Welcome to Disc and Spine Northwest. My name is Travis. I'm the clinic director here. The purpose of this video today is to teach you about the how and what and whys of how we get people well that could not be made well anywhere else. You see, the vast majority of our patients that come here have already tried normal chiropractic and normal physical therapy. They've all had injections, and a high percentage have already had surgeries that didn't work. Now, we deal with people's spines, and in particular, we deal with people with herniated discs, bulging discs, spinal stenosis, serious chronic back pain. Now let's talk about your spine. Your spine serves two purposes for you in your body. The first purpose it serves is it's your frame of your body. Everything's attached to this spine. Your head, your arms and shoulders, your rib cage holding all of your organs in, and your hips and legs. And any stresses you put into your body all go into the spine. Now, the biggest stress that we put into our body, which is also a stress we can't escape or avoid, is the stress of gravity. Gravity is putting a tremendous amount of force on us all day long, planting our butt on this earth. Because of this constant stress of gravity, when God designed our spine, He designed it like a spring. Our back is a series of opposing arches, and that's so it can flex and absorb the stresses that are placed into your body. Now, when you place a load or a weight into an arch, like on a bridge, that load is shared and divided equally amongst the entire arch. And the same thing in your back. When you place the load of your body and gravity into your lower back, that weight of your body is shared and divided equally amongst all 5 discs and all 5 joints in your lower back. Now, from the front view, your spine should be straight like the leg on a table because this is your frame of your body. The second thing that your spine does for you is it houses and protects your spinal cord, which sits right up inside of the backbone. Your spinal cord is a communication link between your brain and your entire body. Every single organ, muscle, tissue, cell of your body has direct control from your brain. How your brain does this: your brain sends messages down your spinal cord. Those messages are relayed out the appropriate spinal nerves, which come out and go to all the organs in that vicinity of your body and the muscles in that part of your body. And then messages also come back from those muscles and organs back up that same nerve fiber, up the spinal cord to the brain to tell the brain what's going on. It's a big communication loop. It's so delicate that when God designed you, He completely encased that spinal cord in bone. It is not supposed to have any pressure on it whatsoever. When we start putting pressure on that spinal cord, like from a bulging disc, let's say, it significantly cuts down the amount of energy coming out that level of your spinal column. The weight of 1 dime will cut down the amount of energy by 50%, the weight of a quarter by 75%. Well, if you only have 25% of the energy coming out these nerves to your muscles become very weak. They fatigue very easily. You can't walk very far. If you only have 25% of this energy coming to your organs down here, your digestive organs stop working properly and you have a lot of food allergies all of a sudden. You have a lot of colon problems. Your reproductive organs are also run by the nerves in your lower back. And we start developing prostate problems, erectile dysfunction, different reproductive problems. Most people don't realize that their chronic back problem leads to different health problems as well. Now, the government has done a tremendous amount of research on back pain because this has become the second most costly thing to the Medicare system. And what the research shows, and it's absolutely correct, there's 2 primary things that cause our discs to wear out and our joints to get arthritic. There is no such thing as degenerative disc disease. It's not a disease at all. We used to think it was a disease, but we know now it's not a disease. It's a compressive lesion. What causes these discs to wear out are either a lateral scoliosis. I'm going to exaggerate here a bit so you can see this. If you've got a bend in your spine where it's supposed to be straight, and then we push down on that spine with gravity all day long, where does all that stress go? Right to the highest point of that bend. That's where the disc wears out. That's where the joints wear out. Now, if this disc is wearing out, you can go do surgery, and you could go in and they could remove that disc and they could fuse those 2 bones together, make that 1 bone. But my question is, where does the stress point move to now? Either up 1 level or down 1 level, and that disc starts to wear out. So back problems are caused by lateral kinks, and you'll see that in your posture. Your shoulders will be not level anymore. Your hips might not be level. Second thing that causes back problems, if we look at this from the side view again, where we're supposed to have these arches, is if you lose one or more of these arches. If you lose an arch, you transfer all of the weight forward onto these discs. And right where your back goes from straight into a curve, it creates a stress point again, and that's where the disc will wear out. That's where the joints will wear out prematurely. See, when you had that arch, the weight was shared evenly amongst the entire arch. When you lose the arch, weight is just transferred down until it goes from straight into an arch again, and it creates a stress point. And those are the two things that cause disc problems and chronic back problems, period. Now, how do we fix a herniated disc? Primary modality we use in our office here is called a spinal decompression table. How that table works, you see it's the compressionary forces of gravity that are squishing your back and causing the disc to bulge out. We want to do the opposite. We want to decompress that spine and pull that spine apart. So we hook you up to this decompression table, and it will gently start to decompress you and pull these joints and discs apart. Now, normally we couldn't do that because the muscles would go into spasm and they would protect that spine from that happening. But how a decompression table works, the DRX table, is as we are pulling you apart, the table is measuring your muscle activity. And every time your muscles turn on, it lets up a bit. And then it'll start pulling, your muscles turn on, it lets up a bit and turns your muscles back off. It'll start pulling, your muscles turn on, it lets up a bit. It does this monitoring and correction 1,000 times every second. As a direct result, within about 15 to 30 seconds, we can have your muscles completely turned off and we can truly start to decompress your spine and pull these discs apart. Now, just like in an accordion, if you pull an accordion apart, it creates a negative vacuum pressure within that accordion and air is sucked into the accordion. If you pull one of these spinal discs apart, it creates a negative vacuum pressure within that disc. The bulging disc material is sucked back into that disc, as well as the nutrients and fluids and blood needed to heal those discs. So this spinal decompression table, it just flat out works. We're batting around 90% right now fixing people's spines or getting them out of pain with this table. But then there's the second question of how do we address the reason that disc went bad in the first place? If the disc went bad because of a kink or a loss of a curve, we have to address that problem as well, or your disc problem will come back. Now, typically when we see a patient, we will treat them for 3 or 4 treatments just using decompression to get them out of pain. It's my experience when you take a painful back and start exercising it, you just aggravate it and flare it up and make it worse. You've probably had the same experience. So for the first 3 or 4 visits, we will work on just getting you out of pain and getting your pain levels lowered. And then we will segue into our very unique physical therapy that we do at our office here. Physical therapy is all designed at our office to strengthen your core muscles on this side of your spine and your postural muscles on this side of your spine. These muscle exercises are designed to remove these kinks and to restore these curves so that your back can heal and not go the wrong direction and start to fail again. A typical treatment protocol in our office is a 20-visit protocol spread out over about a 6 to 10 week period of time. Some patients are a few visits less, some patients are a few visits more, but on average it's about 20 visits. What we'll do with the patient is next step we'll do with you today is we'll do an examination to make sure that you're a candidate for what we do and there's no contraindications for not performing our services with you. If after your examination the doctor determines that he thinks he can fix you, or she, we will accept you for care for a trial period of care of 3 visits, and we will see you 3 days in a row simultaneously doing decompression on your spine. By the end of 3 days, the doctor will have a pretty good estimate of what it's going to take to fix you, and we'll sit down with you at that time and give you your recommended care plan. At the same time, our office manager will sit down with you and go over the cost, what the whole cost of what the doctor is prescribing is, how much your insurance is going to contribute, and how much you're going to have to contribute. The vast majority of our program here is covered by insurance, with the one exception of spinal decompression. Some insurances pay for spinal decompression and some don't. The cost of spinal decompression is $150 a visit if you pay as you go, or $100 a visit if you pay in advance. We offer many different payment options, including an 18-month no interest option, as well as a pay in advance and save 35% off the cost of your care. We try to make it affordable for everybody that we accept for care here at Disc and Spine Northwest. If you're tired of living in pain, not being able to do things in life anymore, and are ready to reclaim your life, you are in absolutely the right spot. One of our doctors will be with you shortly to answer any questions you have, to look at your MRIs and X-rays on our computer, and to see if you're a candidate for what we can help you with. If you're serious about getting well, we're serious about getting you well. Thank you very much for coming today, and we look forward to getting you better.